I'm the consultant in communicable disease control for the Dorset and Somerset Health Protection Unit based here in Somerset.
Okay, thank you. And you've agreed to answer some questions from employees of Somerset County Council about swine flu. So firstly, how long does swine flu last if someone contracts it?
Well, what we're seeing most of the time is that people become ill about 24 to 72 hours after they've had exposure to the disease, although sometimes that's not known. And then most people are ill for about 24 to 48 hours. Sometimes they become quite poorly, they feel lethargic, they've got runny nose, they've got raging temperatures, they feel achy all over. And then many people are actually getting better very, very quickly, particularly the young people, and that's predominantly the largest number we're seeing affected. Some people, unfortunately, are being ill for slightly longer, and on top of the virus infection, the H1N1, they're also developing a bacterial infection. It doesn't happen in very many, and that's the time when the GP gets involved and you might need some antibiotics. But it's the sort of thing that people might experience at any time of year, particularly as I think in the normal phraseology they've got a bit of a weak chest.
And is it right, people are saying it's something that comes on very quickly, is that right?
Yes, it is. Quite often it can be one of these sort of things where you go to work in the morning feeling not too bad, but not quite right, and then by lunchtime you feel that you can't really move out of your chair. It really does come on that quickly. And that's what one of the characteristic symptoms is, this rapid onset of symptoms, particularly the temperature above 38 degrees centigrade.
And if someone goes down with swine flu and then they seem to have got over the worst of it, perhaps they're not aching anymore and the temperature's returning to normal, but they still have a bit of a runny nose, is it wise for them to return to work?
Not really. It's probably better to wait until all the symptoms have cleared up, and in general, in most cases, that's about a week.
And would you say is there a minimum period that people should stay off work if they have swine flu or the symptoms?
A minimum, if you do actually spontaneously recover, is probably a week. However, be guided by how ill you are, and if you really are not very well, don't go back to work. Firstly, because you're not going to be performing at your best, and secondly, you could potentially still be a risk for others.
And is it possible to get swine flu more than once?
No. We say that with some degree of certainty, because we know that when most people have actually been infected to a specific virus and developed antibodies, they're very unlikely, and there aren't too many documentary reports where they've had it again. If you rubbed alcohol gel into your hands or used some kind of treatment like that, would that be enough to kill the virus that's maybe left on a surface that you come into contact? Yes, if you wipe surfaces with the sterile types of wipes and alcohol rub, that's fine. Your hands, if you use the alcohol gel properly and wash all components of your hands with it, not just the palms of your hands, yes, that works very effectively. But good old soap and water is probably the most effective and the most readily available.
Just to move on to obviously people being treated for the symptoms and Tamiflu being issued, what are the side effects or the possible side effects of Tamiflu?
The main side effects of Tamiflu are related to feeling ill. People can sometimes feel a little bit sick with it. Most of this seems to arise because people aren't always given the best advice and don't always read the small print. And what we're suggesting is that people, when they take their Tamiflu, they take it with or after or during eating food, so that actually the food helps allay some of the effects on the gastrointestinal tract. But usually, and for the vast majority, they're quite small, so we would urge people, if they have been prescribed them as treatment, or in some cases prophylaxis, that they adhere to the times and take the whole course. Rather like we say with all antibiotics, we don't want to put the virus in a position where it can get the upper hand by becoming resistant, and we want to ensure that those individuals are protected as